Hey everybody, today I want to talk about some of the signs of instability. This is very, very important. A lot of people do have unstable joints and they don't realize it. This is a really, really key function in helping to resolve someone's problems, but also to help people move towards greater and greater levels of performance. Today I want to talk about what are the signs of instability. So you'll recognize some of what I'm saying and recognize that this is actually a sign of an unstable joint. And if we can resolve these things effectively and thoroughly, not only will it improve your joint health, but it will actually help to take a huge step towards higher and higher levels of performance. Another way of saying the same thing is if you don't resolve instability, that will really hold you back quite significantly from performance. And also, if you keep pushing and pushing through instability, you have a much greater likelihood of causing damage to joints and also having failures as well and more other types of injuries. Stability is absolutely vital. What does instability look like? Well, to understand that, what we really need to do is look at what happens when a joint is unstable. So in the last video, if you haven't seen it, go back. But in the first video, I was talking about how the stabilizing muscles work, and if they're not working, that the joint could potentially move more than it should. So stabilizing muscles are muscles that are very close to a joint. They're very, very close to the axis of motion of the joint and to the sort of most neutral position. So when they contract, they bring the joint back to neutral. And when your joint is moving away from neutral, they're also giving a bit of they're lengthening but holding at the same time. It's sort of like lowering a dinner plate. You have something in your hand and you lower it. You're still contracting the muscle, but you're allowing the muscle to get longer to gently allow that motion to happen. And this is what the stabilizing muscles do. They allow us to move, but they're at the same time holding us so that the joint doesn't actually just fall apart. So if those muscles are not working well, what we'll find is that the joint will move more than it should. And it doesn't happen in every single position. Very often it's related to the position that you had the trauma. So if the trauma drove you and drove your head sort of forward and to the side, it would weaken the muscles that would keep you from moving in that direction, make them less reactive, so that when you move in that direction, those muscles can't actually activate sufficiently to stabilize the joint. What would effectively happen is if every time you're going towards the direction of where you had that trauma, the particular muscle fibers that would be resisting that are less capable of contracting and less capable of stabilizing, less capable of allowing that joint to move in that way in a stabilized fashion. So what would happen is the joint moves more than it should, and then your body goes into panic mode. So when it goes into panic mode, well, you have two choices. Either the joint moves more than it should and you cause a more significant trauma to the joint, which can happen, or your body does some sort of panic mode function, which is going to be to recruit other muscles. So in other words, take other muscles that are near it or in the similar line to it and make those muscles contract to try to stop the motion from happening. And it's not usually intrinsic muscles that are going to do that. It's what we call extrinsic muscles. So they're really muscles that are designed to kind of pull you in the opposite direction. But when you're going in one way, rather than pulling you this way, we can actually still use those same muscles to try to keep you from going in the direction of where the trauma was. So what that means is you recruit extrinsically strong muscles that are really designed to move you the other way. They're going to just contract to try to keep you from moving into the unstable position. So does that work? Yeah, it kind of works. It's not the ideal because there's several reasons. One is extrinsic muscles. When you have an extrinsic muscle compensating or being recruited to try to stabilize the joint, it's not actually stabilizing the joint. What it's doing is trying to pull the joint in the other direction. What that does is creates a load on the joint. Remember I was saying in the last video that there's a compromise to the mechanics of a joint when the muscles become unstable. When you add on top of that an extrinsic muscle contracting, what it's going to do is basically just kind of load the joint, but you're still going to be left with the poor biomechanics. But you're left with poor biomechanics with a much greater increase of load on the joint as well, which doesn't let off. So extrinsic muscles will generally be tight and stay tight for a long period of time, and that constant load on the joint will actually perpetuate the breakdown of the joint tissues. So the cartilage and the structure of the joint will start to break down because it's constantly under load. So that's far less than ideal. It is somewhat of a reasonable compromise because it can allow you to keep moving to some extent, albeit with poor biomechanics in that joint, a greater acceleration of joint breakdown, and you still have that instability there. So in a certain situation, you'll bend into the position of your trauma, and if that extrinsic muscle doesn't have the capacity to try to resist that motion, then you can further injure the joint. And a great example of this is people that they might be working on a construction site all day long and they're fine, but then they go to the supermarket and they bend over and get, some milk off the shelf. They bend over, and that motion there is enough that their body wasn't expecting, that amount of load. You pick up the thing, and you could really put your back out. People go, oh, pop, it made a big clack sound or a pop, and then I was in agony because what happened was the joint moved more than it should. You were already lacking in the stability there, and those extrinsics that were trying to prevent that motion were just either too tired from working or whatever, but they didn't have the capacity to stabilize the joint. It moved more than it should, and then you re-traumatize the joint. So this is a very, very typical scenario. There's lots and lots of examples of how that can happen. So, but this can be very confusing for doctors and for patients because the problem that we see with the stabilizers is when we are trying to find where the joint can't go back to neutral. If we can resolve that, then at least at a local level, we're resolving that stability. There's many, many layers to this, but that's the first kind of step that we need to take, or at least one key step of resolving the joints. But if we also have this extrinsic tension, sometimes that's more obvious because that extrinsic tension is what's keeping us from being able to bend in different directions as well. And it also feels very uncomfortable because extrinsic muscles are designed to be contracting and relaxing, contracting, relaxing. That's the way they're meant to work. They're meant for movement. So they allow us to contract and then relax, to move it again, and then contract, relax. They're muscles that are designed to do this all day. The intrinsic muscles are designed to hold all day. So they have a much higher metabolism and a different functional capacity. So if extrinsic muscles, again, that are supposed to be contracting and relaxing, are having to contract and hold all day long, they start to fatigue, okay? And there's many other consequences of this extrinsic tension I'll get into in another video, but if those extrinsic muscles are tight, they're going to fatigue and they're going to start feeling really uncomfortable. And it's so much so that people will just go, oh, I have to do something about this. I can't continue with my life while I have this tension. So we'll do all kinds of stuff to make those extrinsic muscles relax. So we might do stretches because they say, oh, I just can't bend in this direction because these extrinsic muscles are preventing me from bending that way. So we try to bend that way. Or we have someone massage the muscle, or we have some sort of therapy to make these muscles in our neck or in our back relax so that we can kind of move our joints. And sometimes, even in chiropractic, we can say, well, your joint just can't bend this way, or you can't turn your head because these muscles are so tight. Well, those muscles are actually trying to create stability where there's instability. So if we do something to try to stretch those muscles and make those extrinsic muscles relax, whether that's a end-range chiropractic adjustment or a massage or some sort of therapy to make these muscles relax, we have to ask ourselves, are we doing that for the greatest benefit of that person and for that joint? Or are we just releasing the compensation for an unstable joint? Because if that's what's happening, then what we're doing is we're leaving the joint in an unstable position or an unstable level of function without any compensation. And the best way to know if that's the case is just by looking at the result of the treatment. If you have a massage, or you have a muscle therapy, or you have an adjustment, an end range adjustment that stretches a muscle, that gives you some relief for the day, if it lasts, then it's probably good for you. But if the next day or the day after it's tight again, then what that's telling us is that that muscle was there, that muscle tension was there for a reason. It was trying to compensate for an underlying instability. So if we haven't resolved that instability, then that muscle tension will come back. So this is kind of a bit of a mind-blowing concept, but we really have to be mindful of what it is that we're trying to do, which muscles we're working, and what the ultimate goal is. If the ultimate goal is for the performance of the joint, we have to first focus on stability of the joint. When we focus on stability of the joint, what we end up doing is resolving the need for those other muscles to compensate, for those other muscles to be recruited to deal with the instability. If we resolve the instability, then these other muscles don't have to be tight, and we'll see that they just relax straight away. Like literally in seconds, those extrinsic muscles in the neck, in the back, they just melt away. They're gone, because your body recognizes immediately that there's no need for that tension anymore. So we don't have to do huge stretches, we don't have to do masses of therapies to try to get these extrinsic muscles to relax. All that we have to do is understand why they're tight and look at the underlying reason. And if we, again, first focus on building block number one, stability, then we get stability, we have biomechanical control, and then all of these other extrinsic tensions can melt away. And then not only are they not tight, but then you have much better range of motion and movement, and everything else carries on in a much greater way from there. So anyway, I hope that's interesting to you. In the next video, what I'm going to do is I'm going to talk about what's happening when these extrinsic muscles are tight, how that compromises our strength and flexibility and the endurance of the muscles. So stay tuned for that, and if you have any questions or comments, just drop them below, and thanks for watching.